Hi, my name is Lee McBride. I'm the director at Porter Memorial Library in Machias. I'm very pleased to be here tonight, and I want to thank UMM for lending their fine facilities for this event. I work with Megan Duff, and Megan's in the Psychology and Community Studies program at UMM. She said, how can I help? I said, I need to have a forum, a public health forum. She said, how can I help? I thought that was great. So here we are. I work with the support of the Maine State Library System, which is a very helpful group of people. And they keep me apprised of all the things I'm supposed to know. So a few weeks ago when I was getting messages that I was supposed to know about the Affordable Care Act, I thought, uh-oh, I don't. So that was why I got motivated to have this meeting tonight. I thought there's a lot of clarification people would like to have about the Affordable Care Act. A lot of people wonder, does it apply to me? There are just so many questions about it. So I'm glad to see many of you here tonight to try to answer those questions for yourselves. That's what we have to do. So I'm very happy to have two speakers tonight. We've got Deidre DeRoche. Deidre is from Maine Community Health Options. She has 20 years of experience in the health care industry, and she's excited about the co-op model, which is what you'll hear about, I think, from her. That's what Maine Community Health Options is, and I won't try to explain it. She knows how to do that. So we'll start with Deidre, and later in the evening, we'll have a break after Deidre's.
We're actually going to start.
Oh, we are? We're starting with Deb?
Yeah, just,
oh,
yeah.
Excuse me.
We're gonna
they switched it on me.
We're pinch hitting a little
yes.
bit. We just
okay.
Tag teaming it.
Wonderful. Well, I have this other great lady named Deb Shields from the Eastport Health Center. And, we'll just get started.
Great. Thank you so much.
Can I just do one housekeeping?
Of course.
I'm Megan Duff from the Psychology and Community Studies program, and I just wanted to tell you two things housekeeping-wise. Bathrooms are straight out there and then take a left. And the other thing is that we're streaming this today, so just keep that in mind. I heard that you're going to be encouraged to ask questions as you have them, at least when you speak.
Yes.
So we also have people in the audience that are watching over the computer, and it's being recorded, so just something you want to think about since we're talking about healthcare. Thanks.
Okay, very good. Thank you all for coming tonight. This is really a nice turnout. We're really encouraged very much, and what a great facility. We really want to thank you, Lee, both. And it's so kind of you to ask us to come and speak with you here today. So I'm Deb Shields, and I'm from Eastport Health Center, and I'm an outreach and enrollment coordinator. And I'm a certified CAC, which is certified application counselor. So that's a lot of language there, but basically what we're saying is that I am here to help you figure out this marketplace and what it means to you. And I'm not alone. We have an interesting model here in Washington County. We are actually coordinating with 5 health centers. So Eastport Health Center is one of them. And then we also have, from top to bottom, we have Christy Parker all the way up in at East Grand Health Center, which is in Danforth. And then we have Sue Mahar, who's at St. Croix Health Center in Princeton. And we also have Angela Doobie, who is at Lubec Health Center, Healthways. And also Sue Beal in Harrington at the health center there. So we are all outreach and enrollment coordinators, and we're all helping people understand this confusing marketplace. And I won't lie to you, I'm not going to pretend that it isn't. This is a big change, and we're all pretty, as outreach and enrollment coordinators, we're all pretty excited about the changes that are happening, and we're pretty positive about it. It's, but I won't lie to you, it hasn't been the easiest rollout. And my feeling is that we're going to get through this. Websites are not rocket science. I'm thinking that this one is going to get up and running at the capacity that it was intended to fairly soon. And when it does, things are going to start looking a lot easier to understand. So let me just explain a little bit about what the role of an outreach and enrollment coordinator is. As part of this rollout, they've identified people that are navigators, and these are people that help in a particular area. It's the same kind of job that I'm doing. It's outreach work, but it's also one-on-one sit-downs with people in front of the computer, looking at websites and looking at numbers and letting them put their own personal information into the system, and then seeing what kind of program they can qualify for. It also takes into account the subsidies that the government will give you. So that's what a navigator does. Actually, outreach and enrollment coordinators do the same function. It's just that we're kind of one level down. We are there's a few more of us than there are navigators. Actually, in Washington, Hancock, and Penobscot counties, there's one navigator to cover that whole area. But in Washington County, we have 5 outreach and enrollment coordinators. So we're kind of on the front line, and we're the ones that are trying to see as many people as we can. And so if there's one message I can give you, it's that there's people out there that can help. And we don't capture your information. That's yours, and it's yours personally to keep. We assist you to put your information into the website and then come up with some numbers that make sense to you. So with that, I just want to tell you a little bit. We've had an introduction already about Deidre DeRoche from Maine Community Health Options. It's one of the 2 insurance providers that are participating in the Maine marketplace. We are actually, it's, 2, they talk often about the mega mall. And some states maybe have a mega mall. We have 2 stores in our mall. And one is Maine Community Health Options, the other is Anthem. That sounds like we don't have a lot of choices, but in reality we really do. Because within each one of those insurance providers, there are multiple choices. And we're better off than some states. Some states really only have one insurance provider. They'll have multiple plans underneath that, and we will, in a few minutes, talk about the metal plans, and they'll have multiple options within each one of those categories. But really, I believe there's enough choices in Maine. New Hampshire, they have one choice, one provider choice. But, and these things are going to change. I really think that this is the first year, and there's going to be other insurance companies that are going to step up and take a look at what's happening here and choose to participate in the marketplace. So if I can, let me introduce Deidre from Maine Community Health Options, and we'll go from there.
Great, thank you. We're just going to unplug and do a little switch here. So I am Deidre DeRoche, and I am with Maine Community Health Options. Like Deb said, we are one of 2 qualified health plans that are on the marketplace, and the other being Anthem. So when you, or if you have tried to go on to healthcare.gov. Ideally, when it's up and working correctly, you should be able to see Anthem, Maine Community Health Options, and compare our plans side by side and really compare apples to apples. So typically what I do is I go through a pretty wordy PowerPoint. I have found that when I do that, the glazed look comes fairly quickly. So I try to veer away from just talking PowerPoint. So what I'll do is about halfway through, I'm gonna jump onto our website so you can actually see our premiums, see what the tax credit looks like, and just see how you could go onto our website and get, find a quote for yourself or your family member. So if I were following the PowerPoint that I have, this is the typically the agenda we go through. We talk about healthcare, the health insurance marketplace, and making sense of the alphabet soup, really, the ACA, the PCPs, the HIMs, the second language that we are all now finding that we need to learn and understand. Then we'll talk about the new healthcare insurance marketplace and the Affordable Care Act. Then we're going to touch on Maine Community Health Options when we are a consumer operated oriented plan. And if anybody can't hear me, let me know. And also if you have questions throughout, let me know. We don't need to wait to the end. If something sparks a question, you know, holler it out and we'll see what we can do to find an answer for you. So what I like to start with is just sort of, this goes over a little bit of the lingo, but the reason that I find that this is important is because when folks start looking for an insurance company, what they do is they immediately say, what's the premium? Which one's the lowest? This is the one that I can afford. There's other factors that you really want to consider when you're looking at the plans when you go on there. You want, other than the premium, you want to look at what copays are, co-insurance, and all of them, but this is just, I'm talking financial, the deductibles, out-of-pocket max, did I miss anything? And the premium. So a copay, just to give you a brief, some of that you may be very familiar with this, others may not. A copay is a flat amount. It's a flat set fee which will remain the same. So if you go, just say your copay is $20 when you go to see your doctor, every time you see your doctor it would be that $20. So you would know what your copay is up front. A co-insurance is actually a percentage of a cost. So it may be that once you meet your deductible, the insurance starts covering 60%. And so a co-insurance would be 40%. So that amount will fluctuate, the percentage would stay the same. But again, so if you see a coverage that would be 60%, you want to keep in mind that that's based on the cost. So obviously larger medical needs would be a larger out-of-pocket, and a smaller would be smaller, but that is a fluctuating cost. Then your deductible is a set amount, and that would remain the same. Just say it's $500 or $5,000 deductible. That's going to stay the same. That will be per year, and your costs will go toward that. A point I want to make on the deductible is that we all are familiar with the plans that used to have the $15,000, or maybe we still have these plans that are $15,000 deductibles. So folks would pay these premiums, have these high deductibles where they simply were afraid to use a doctor because they didn't want to have to pay everything up front. One thing about the Affordable Care Act, whatever your feelings are on it, is really that is not allowed any longer. The highest out-of-pocket that, and it's not small change, I don't want to imply that it is, but it has now been reduced to $6,350 would be the highest out-of-pocket that one could pay. And so right off, right out of the gate, the folks that have that $15,000 plan will be immediately affected by the Affordable Care Act with an enormous reduction in their out-of-pocket. And the out-of-pocket max is all of your costs going into the out-of-pocket max. The out-of-pocket max, like I said, under the Affordable Care Act is $6,350. So with Maine Community Health Options, we have, and you want to really look at plans will differ, so when you're comparing the apples to apples, these are the kind of details you want to look at when you're thinking about what plan's going to meet your family's needs. what the financial impact will be for me. Maine Community Health Options has decided to use everything, co-pays, deductibles, co-insurance for medical as well as prescription goes to the same out-of-pocket limit. So an individual, every bit of what they pay up front, other than your premium, would go to that $6,350. If once you $1 over that, you would have no cost to you for the remainder of that year. Everything would be covered at 100%. So you want to, not every carrier combines the prescriptions and the medical. So you may find that you have a $6,350 out-of-pocket max for your prescription and a $6,350 for your medical. Maine Community Health Option does not do that. So you just want to keep that in mind when you start comparing plans. For the formulary, you'll see that, and that's really a list of drugs that are covered under each insurance plan, and you would find that on Anthem site as well as our site, and you could compare to, they're typically the same because it's the standard prescriptions that are covered. This is a little bit of a crazy slide, but it really just talks about the relationship between the providers, your employer, your healthcare, insurance, and just sort of the cycle of it. You'll see that I kind of skip over some of these slides. Not that I don't find them important, but I really want to touch on the things that are going to impact you the most. And again, if you see something that you're like, wait, holler out, and we can certainly focus on it. We touched on this as the general rules. It talks about the deductibles, the co-insurance. And we also touched briefly on this, and this is really what the Affordable Care Act, what it has done so far, what it will be doing. One of the important notes that I like to make are the bankruptcy in Maine around healthcare was 1,400. And that 1,400 that went bankrupt because of medical costs, they had insurance. So these are the folks that had these extremely high deductibles. So they had, and there were lifetime maxes, so if they hit their lifetime max, they then had to pay everything. The Affordable Care Act removed lifetime max, there's no cap, and they also removed pre-existing conditions. So folks that were unable to get insured because of their past claim history can now find insurance and not be penalized. Maine Community Health Options we are a consumer-operated and oriented plan, and with the Affordable Care Act is the law. 60% of Americans still don't know it's a law that has passed and is in place because it has been changing, but it is in place. Once that law passed, each state was given the opportunity to create a nonprofit co-op, and 24 states were awarded that, Maine being one of them. And that's where Maine Community Health Options had the opportunity to be created. We received a loan from the government, $7 million to actually start up the company. It was $61.2 million in total. $7 million to start our company, the remainder for solvency to pay claims, to have even out the risk pool of folks that are going to have some pent-up needs that haven't had insurance for quite some time or ever, and we have to pay that back within 15 years. And so the co-op portion of it, the consumer-oriented, what that means is we are going to, 51% of our board will in fact be members of our plan. So it's really the first time that Mainers will have the opportunity to steer the ship of where they want their coverage to go, what they want their insurance to look like. So members of the plan will have the majority of our board. So anybody in this room could be on the board. It's an election process, so if you become a member, we certainly encourage you to reach out if you're interested to be on the board of directors. And we are local. We're in Lewiston, Maine. We are in the Bates Mill. We wanted to bring life back into the mill, so we could have gone to Portland, but they focused on Lewiston, which I think is great. Each decision that they're making, it's been purposeful, it's been meaningful, And so they're really trying to do the right thing right from, from where we are to the coverage that we offer. And again, we're nonprofit. We will always be nonprofit. It's in the law that the co-ops that were created are nonprofit. We'll never be purchased, sold, absorbed by a for-profit. We're nonprofit, or we are nothing, which is reassuring to the employees, and it's reassuring to the community that, down the road, we're not gonna all of a sudden have stakeholders where we, are responsible to pay. So as we pay back the loan, anything that we're making from premiums above and beyond keeping the business afloat, paying back that loan, will go into keeping premiums low or reducing them and enhancing our benefits. And that's what's great about a nonprofit. We don't have a lot of that overhead where for-profit companies do. The marketplace. So I don't know if anybody in here has actually tried to go on healthcare.gov and if anybody's been successful at it. There's been some bumps, as we all have heard on the news. It's been a tough go. But like I said earlier, typically when it should be any day that it's up and running appropriately, you should be able to go on, you will see Anthem, you'll see Maine Community Health Options, and again, you'll be able to compare. And we encourage you to look at every plan, every carrier, and really find the right coverage for your family. There's lots of options. And like Deb said, we have two, and that was the reason why co-ops were given the opportunity to be created. It really was to give states the opportunity to have some competition, which will allow premiums to stay as low as possible rather than having just one carrier. So the Affordable Care Act requires health insurance companies to cover 10 essential health benefit categories. I'm not going to read through them all, but each plan that you look at is required by law to have coverage under each of these categories. So mental health, maternity, hospital. So like I said, there's right out of the gate, there's a core set of essential benefits that you will have in each plan that you're looking at. And online on our website, which is maineoptions.org, it's on my card as well as the handout. You can go in and actually look at this in more detail under the benefit summaries, and it will go into what's covered, how much. Preventative care services are a requirement under the Affordable Care Act, and they're at no charge to the member. So if you sign up with Anthem or Maine Community Health Options, you will have preventative health care at no cost. Your primary care visit for your well visit would be at no cost. Children's immunizations, no cost. You'd have your GYN, your mammos at no cost. So that, again, because of the law, is a wonderful enhancement of what's offered just standard with insurances. And again, if there's questions.
Is that with either one?
Yes, yep, that's across the board. That's that's a requirement within the Affordable Care Act law.
Oh, okay.
Yep. So the structure of the plans under Anthem and under Maine Community Health Option are metal level plans. So each of us will have, we may have one, we may have two, we have three. We don't have to have the same amount of plans offered, but we will each have a gold, a silver, and a bronze available. Bronze being 60% of the cost is paid by insurance, meaning your premium's going to be lower, but your out-of-pocket will be higher. So often somebody on the healthier side might say, you know what, I'm gonna take the bronze because I don't go to the doctor that often. So my premium will be low, and because I don't go to the doctor and my out-of-pocket costs would be higher, that's going to fit my needs. The silver plan is the middle of the road. We have the same coverage, but we're this is really talking about we are out of pocket. So the silver is 70% of the cost, so the premium's going to be a little bit higher, and your out-of-pocket costs will be a little bit lower. And the gold plan is premiums, that's the highest premium level and the lowest out-of-pocket. So those are the structure for Anthem as well as Maine Community. So just to be familiar with when you see the word silver, gold, you know, that's what they're referring to.
I read that there's supposed to be a platinum plan also.
There is a platinum plan available in some other states. Maine has chosen not, or we have chosen not to do it because the premiums that would have been 90% covered, we found that the premiums were just really extraordinarily high. So we wanted to focus, and Anthem did the same. So we stayed with the gold, silver, and bronze, and tried to enhance those benefits as much as possible.
So with all, the whole 3 plans, if they meet the 6,000 some odd dollars, whatever you said it was.
$6,350.
Okay, if they meet that, if they pay that out of that, is everything gonna be covered after that 6,000 on all 3 different plans?
Yes, yes. Did everybody hear the question? Okay, yes. That's the cap. That is the most that one would pay, and that's an individual. So if you have a family, it would be an individual at $6,350, and then there would be an additional $6,350 for the family. So if I have healthcare needs and in March I meet that $6,350 myself, from that point on, I will not pay anything for my healthcare for the remainder of that year. But my family will still be paying their co-pays, their co-insurances, their deductible until one person can meet it, or all of the family members can meet it, but they need to meet that second $6,350.
Each individual? Or just-
No, just there's mine, and then there's another one for the family. So you can all meet it together, or one person could meet it, but once it's met, then the whole family then would be covered at 100% for the remainder of the year. Which also, I want to touch on that Maine Community Health Options has decided to do a rollover of deductible. So we don't want to penalize anybody for receiving or putting, money out at the end of the year. So anything that you put toward your deductible in October, November, and December, we will roll over to the following year. So that will basically be a credit to your deductible the following year. So if you meet 200 of a $500 deductible in January, and then you make, the 300 is in October, we will roll over the 300. So it's just what's met in the last 3 months, but it will credit your following year. This just talks about the online portal, which is the healthcare.gov. It's a little bogged down right now, but it's what they're calling it is a no-wrong door, which means you go in and it's really more of a TurboTax style, where it will really walk you through. It will, it's not going to have you go in a direction where you forget to fill something out. It walks you through the steps. It explains what you need to enter. And it also will tell you if you're entering it, it will say, oh, did you know your partner's eligible for Maine Care or Medicare? So if somebody is eligible for Maine Care, Medicare, or your child, the CHIP program, it will tell you and it will point you in that direction to enroll them. So it's not going to have you enroll the whole family, get to the end, and you find out that a family member is eligible for another plan. And the reason that is important is if you are offered another insurance, or if you are offered insurance, then you are not eligible to receive the advanced tax credits. And so, when folks find out on here that anybody can enroll with us, whether they, make $1 million, $5, that they can enroll, but it doesn't mean that everybody's going to be eligible for the tax credit. So if you have insurance available to you, you will not be eligible to receive the governmental advanced tax credit. When also, there's 2 issues that we're going to talk about: the advanced tax credit, who is eligible for it, the folks that make between 100% of the federal poverty level and 400%. And in the handout that I gave you, there is this, I think I actually copied it twice, but there is a slide in here. And I don't know if you guys can see this, but it actually gives examples of an individual and a family of 4. And so when I speak of the federal poverty level, just to give you an idea, for an individual, 100% of the federal poverty level is 11,490, and 400% is 45,960. So if you're an individual and you make in between, from the 11,000 some on to the 45,000, and you don't have insurance available, you're eligible to receive the advanced tax credit. And again, it gives the example of a family of 4, but there's obviously a family of 2, 3, so this is just to give you an idea of where that range falls. But you'll notice that I mentioned that it's 100% to 400%. So the folks that are at 99% and below, which is, a good amount of folks, and are uncategorical, meaning that they're, healthy, they don't have a child, and they're not eligible for Maine Care or Medicare, they're not eligible to receive the tax credit this year, which is unfortunate.
Where did you see that 11,000?
It's on the slide, and so it's on the bottom, so right here, 100% is here,
Okay, I
and the
see.
400% is right here.
Very good, thank you.
So that leaves a lot, some folks that are in need of the assistance, without the advantage of receiving an advanced tax credit. Now, what the answer really is it's sort of, it's the way it's always been for them. There's still the free care, there's the sliding, fees. There's still care available. They're unfortunately not eligible to receive that tax credit. So that is, why we encourage folks to reach out to their state rep, to their governor, and encourage the expansion of Maine Care. Because when the law was written, it was with the assumption that all states would have had the expansion, which would have covered the folks that fall below that 100%.
Can I just say something about that piece of it? Here, we're going to bring it back home to Washington County and to Maine in general. The people that it was intended, the law was written so that it was intended that people that fall in that range would have been covered by Maine Care. Our legislature voted and they voted and approved it. Our governor vetoed it. And it's felt that in this state we're going to try again to put it out for vote again in January, and we'll see how it goes then. But just so you know that here in Washington County, we have one representative, that would be Catherine Cassidy, that voted for it. The other representatives, and we have 6 in Washington County, voted against it. So if there's one message that you go away with today, it's that you ask your representative to vote for the expansion to Maine Care, because it means an awful lot to people that currently are not being covered. They're in a gap, and there's nothing, they're in the same situation now that they've always been, but it could have been so much better for them. And I think that it shouldn't be our choice to make whether they get covered or not. They should be allowed to be covered like everyone else. So take that message away. Thank you.
Back to, my husband has insurance. So when you said that we wouldn't be available for the tax credit, because where he has insurance, so when I do my taxes, I'm not gonna be eligible for the advanced tax credit, even though I don't have insurance?
That's a great question. That's the second loophole of the Affordable Care Act. When the law was written, the federal government said that they're going to base affordability on the individual plan. So what that means is if my employer offers me insurance and it's affordable, the government says 9.5% or below is considered affordable for your insurance. So if my individual plan through my employer is considered affordable, and I choose to then enroll my partner, my spouse, or my dependents, or either or, and that plan is not considered affordable, it's that your family is still then exempt from that tax credit because you are offered insurance through your spouse or partner's employer.
Is that your particular situation, that your husband's employer is offering
We
family
pay for it
coverage?
ourselves,
Mhm.
but as far as me, I mean, my employer, no, is
Right.
not offering.
But if you file jointly,
We do.
it's based on how you file your taxes, and if your spouse is eligible to receive insurance and the employer offers a family plan, then you are exempt from the tax credit.
You couldn't afford the family plan.
Which is, that's, a lot of folks cannot, and a lot of small employers are talking and have made the choice to not offer the family plan, that they are only offering the individual, which it's cheaper for the company, but it also allows the family then to be eligible to receive affordable health care.
A lot of companies are reconsidering that option to cover family, just because of this particular family glitch in the law. And it really is, it was never meant to be interpreted that way. It's often, go ahead.
Even if the employer does not contribute at all?
That is a question that I'm gonna point you to healthcare.gov, the 1-800 number, which is included in here. Just because of the details of that, I am unsure of. I don't want to point you in the wrong direction, but my belief is that if it's offered through, if they don't contribute, I'm not sure, but because you're offered that plan through them where they're getting a group rate, I'm a little hesitant.
Yeah.
If there's a question.
My understanding is that if anyone in the family is offered individual coverage through their employer, then no one else is eligible to buy through the exchange. I've been told that more than once.
No, if it's individual, just individual, then the family is still eligible to receive the remaining, this individual is not, but the family is eligible to receive the tax credit. If that individual is offered an individual plan as well as the family, that's when the family becomes exempt.
Okay. And if an employer has a group that currently is offered a family plan option, but no one has ever accepted that, and that group is still going to be offered that, by the insurance company, can the employers have a rule within their company saying that's not even offered, even though it's
Yes.
Yes,
possible?
that is, a lot of companies are choosing to do that.
Well, that's good to know.
You had a question over here?
Is income considered head of household or total family members?
Income is considered the adjusted family income, so it's what you, when you do your taxes. And the details of that, we touch on it a little bit further in. When I go to our website, there'll be a sort of blurb on it, but the description and the details are on healthcare.gov, where it breaks down exactly what's included in the figuring of the family, adjusted family income.
I have,
Oh, just,
sorry.
no, go ahead.
I have insurance, I only work 20 hours a week. I have insurance, I have to pay for my own premium. Because I only work 20 hours a week, I have to take the lowest one in order to get any money to take home, which means that my copay, my deductible is outrageous. I had blood work done and it didn't pay any of it. I have an $800 bill for blood work because the insurance company, my deductible is so high. So if I was to drop that, I couldn't take this?
If it is offered, yes,
It
and
is.
if it's considered affordable,
Yeah,
which is that 9.5% of your income. And so, most employers in Maine offer affordable, which is under that 9.5, but if you question that it falls outside of that range, you can certainly reach out to healthcare.gov, and if that is the case, you can receive a waiver where you could then be eligible, but it would take a waiver.
Okay, thank you.
Yeah, there was a question over here, sir.
And my wife and I are both covered by insurance. We've always paid out of pocket for our remaining child. And I was told that if we don't get this coverage here with the community, that there's a fine. With our own company, it's exorbitant to pay for her. So
I think
there's no choice there.
what you're referring to is the penalty.
Yeah.
We were gonna talk about that in a little bit, but let me touch on it now. The penalty is, it's related to your taxes. When you sign up, that's how they do the advanced tax credit, it's through your taxes, which I will go into more detail on that. But the penalty, if you are without insurance and you file your taxes at the end of the year, there is a penalty. The first year, it is $95 per adult, half for a child, or 1% of your income, whichever is greater. The second year, that goes up to $395 per adult, half for a child, 2% of your income, whichever is greater. And the third year is $695 per adult, half for a child, or 3% of your income, whichever is greater. Open enrollment this year is October 1st to the end of March. Someone mentioned that they heard today that that might have been extended. I haven't heard that. It may be, but as of right now, what I know is October 1st to March 31st, which means if someone signs up for insurance on October 31st, they won't be penalized. They have that 3 months of 2014 to be without insurance, as long as you enroll within that range.
Wasn't it supposed to be the summer 15th?
Going forward, well, December 15th is the last day for you to get coverage by the 1st. So you need to have enrolled, sent your payment in by December 15th of this year to have your coverage start on the 1st. And that's each month there until the end of March. So if you enrolled on January 15th, your coverage would start February 1st. If you enrolled January 16th, it would be March 1st. So it's the standard by the 15th of each month. Going forward after this year, open enrollment will be October 1st to mid-December. This first year, they've extended it for 3 months into 2014.
October 1st to what?
Mid-December, and that's when open enrollment will end in years coming up.
Now, on your penalty, is that $95 monthly or $95 a year?
That, and it's the government that would be, is doing the penalty. It's not Maine Community Health Options, but that is per year. It's when you file your taxes, it would be.
Because I got a paper that someone had given to me that they printed off, and it said that most people think it is annual, but this guy is saying in fact that it is monthly.
No, it's an annual charge.
And the other issue with that is that really the very first time that anyone would be charged any fee or any mandated fee would be when they file their taxes in 2015. Because 2014 you're going to incur that fee over a year's period. And they keep signaling me to get to the center of the room.
But it's not just $95, it's $95
Or
1%.
1%, that's correct, that's correct.
And
There's
you're
$95 per person in your household.
Per adult
Per
and
adult.
half per child.
Right.
Correct. And so it is something to keep in mind, that 1%.
Yes.
I'm covered by the health insurance through the school, so does that mean I have to get more insurance?
No, that's good enough.
Because I know that it won't cover me in the summer, but.
You at that point, with the loss of insurance, open enrollment is through March 31st, but if there's a life-changing event, you lose your insurance, loss of a job, gain of a job, birth of a baby, adoption, those type of things, you can enroll at that point. So if your insurance drops at that point, you would be able to enroll.
Right.
I mean, you certainly could enroll prior to that, I'm sorry.
Well, I know it'll be like during just the school year, so does that mean I pay for a different insurance for the summer and then go back on the insurance in the school year again?
If you take the insurance through school, it would be you would pay for your insurance through school and then enroll, when that drops.
Aren't you allowed a 3-month gap any time in the year for coverage?
There is, yes, if you married or divorced, lost the job, there is that 3 months. So if it dropped in October, you'd be okay through the end of the year. But if it's drops in June, you're going to want to get coverage. So it's a decision that you're going to want to make of look what you're paying for the school insurance versus what you would pay with the tax credit. You just want to compare.
So she can get it starting in June. She's talking about open enrollment, but if she loses her regular insurance and then needs something, she can apply for it in June.
In June, and she'll have a 3-month window there.
And you can
So
waive your school
that's correct.
insurance.
There is
You can waive
also
your school
something
tax
I'd like to
bill
say
if
about the
you
hardship waivers. There are some exemptions to the fee, and there's actually quite a list. One of them being that it's not affordable coverage for you. So and also those people that are falling into that gap where they could have qualified for an expansion of Maine Care, those people will be getting a waiver of that fee.
They wouldn't be responsible for the penalty.
There's also a group, there's a fairly large list of exemptions. For example, people that have had their utility shut off, people that have had, that have been exposed to domestic violence have an exemption for that year. There's several different categories that are hardship exemptions that people could possibly qualify for. So not everyone is going to have that fee.
And so the details of this, there's a lot of personal questions that come up that you need to, we don't want to necessarily expose in a setting like this. And that's where Deb or any of the certified application counselors, or you could certainly call Maine Community directly. We can talk about your situation individually, if you don't have access to a computer, because if you do, you can go online and do, peek at that yourself, but there's people that can go through that with you and help you with the details of that and actually figure out if you meet that exemption or not. So enrollment, we talked about the dates of enrollment, but the people to be eligible, you need to be a resident of Maine. It's the state where you would gain insurance. And so if you're a snowbird and you leave for 3 months, if your residence is in Maine, then you would be eligible in Maine. That's where you would want to enroll with your insurance. We have a nationwide RAP network, which means if you're out of state, there are in-network positions that are available wherever you are, and those are also listed on our website. We have a statewide network. We did not choose to do a limited network within the state. We just received our last signed contract from Calais Hospital, which was the last hospital for the state. So we have 100% of the hospitals, which means 100% of the doctors that are employed through them. And we are constantly working on, building the network, so individual physicians, smaller groups. And if you go online and you find that your physician is not participating, we welcome you to reach out to us, let us know through email, call us, and we will certainly reach out to that physician. And if they're interested, then we will start that application process with them, because we really want to foster relationships that people have with the physicians that they have had, and that they know. The doctor knows their history, that person knows the physician, and we want that relationship to remain intact if at all possible.
Is Down East Hospital, are they involved, participant?
Yes, all the hospitals in the state. So again, these are the dates that we talked about. So that December 15th that was mentioned is the date that to gain coverage beginning January 1st, you need to be enrolled by December 15th. So again, if you enroll on December 16th, you're going to have to wait until February 1st. No penalty there, but you would not be eligible for coverage there in January.
Why does it take 15 days, excuse me, to start?
What's that?
Excuse me.
Why does it take 15 days to start? Like, when do you enroll, why are you just not enrolling on that day?
Well, because we need to receive the check, we need to, enter people into the system, there's a processing period. And so leaving 2 weeks really is really quite a tight enrollment setup process for the person to receive their ID card. Coverage for the Affordable Care Act doesn't start until January 1st, so you wouldn't be eligible to start on December 15th. But on the months, going forward, it is because we as an insurance company, and because we're also verifying the tax credits, we need that 2 weeks to actually get that person enrolled.
That would be the same for group insurance also through an employer. They always require that same time period to enroll.
Okay, so premiums, this is where we're gonna kind of veer away from the PowerPoint. I'm gonna log on to our website. But a couple things to note that when you're looking at the insurance companies, you're comparing rates, you're comparing plans, what premiums are based on. There's 4 rating areas in the state of Maine. These have been around for a long time. We just haven't been aware of this because the transparency has not been out there with insurance companies. And now finally, because of the law, insurance companies need to be transparent of how they come up with their premiums, what is covered. So what you will see is that someone down in Portland is going to be paying less than a person in Washington County because the cost of care in Washington County is higher. But that's if you signed up with us with no tax credit. If you're eligible for a tax credit, if I'm in Portland and I make a certain amount and I'm eligible for a tax credit, and this person up in Washington County makes that same amount, is eligible for a tax credit, we will then pay the same premium because the person in Washington County would then receive a larger tax credit to bring the premium down to what's considered affordable. So back to the form that I had referred to a little bit earlier, just an example of that, if somebody were making between 100% of the federal poverty level and 133%, what the government is saying is affordable for that bracket is 2% of their income. So their premiums would be between $19 and $25 per month. So that would be across the board. So whatever it takes to bring their premium down in Portland will be a little bit less than what it takes to bring their premium down to $19 in Washington County. So again, you would both be paying the lower premium and one would be receiving a larger tax credit. So I'm just gonna hop out of here. And we can touch on that. There's gonna be questions because that's, the tax credit we're gonna get into. Our website again is maineoptions.org, and this is the homepage. When you go, this is what you'll see. Now, if you want to go and compare plans, see what you might be eligible for a tax credit, or if you're eligible, see what our premiums look like. When you go here, you're going to go up in the corner here, where it says compare plans and receive a quote. You're going to click on that. And the page that it brings up, you'll see that it lists all of the plans that we have available. You can certainly click on those, look at them individually, but what I would suggest is to scroll down just a little bit and go here to get a quote. And what we're going to do is we're going to just put in some information just to give you an idea. I'm going to make up some numbers, but what is the zip code here?
44654.
54?
Yeah.
Okay, so I'm going to say that I want coverage to start on the 1st. And we did this last night, there was no locking, so I expect it to be the same. This will be my birthday. Okay. Female. I'm not going to add a dependent or a spouse right now. So this would be for an individual plan. You hit next. So it's going to ask here, and none of this is captured. So you can go in here, play. If you think if your neighbor put it in here, see if they're eligible for something. It doesn't capture anything. It really is just so you can get an idea of what's out there, what you would be responsible for. So what I'm gonna do is I'm gonna go in the range of between 133% and 150% of the federal poverty level. So I'm gonna put myself, actually I'll just put myself at 15,000. Okay. Now here it says, what is your household size? So there's a confusion around this. It's asking what is your household size. It's not asking who's applying, who is going to be on this plan. It literally wants to know who resides in your home. Because what they're doing is they're saying, okay, there's, you know, this person has 2 foster children, they have a mom that lives with them. There's this many people that potentially could be living off this income. So you really want to be accurate on that. It's not, you're not adding anything, nobody's income, if they are not a dependent, but you want to include who resides in your home. So I'm gonna, I don't know what I did here. Hold on. I did that. So I'm gonna put 1. It asks, is there affordable coverage through my employer? I'm going to say no. It will ask if you are, or any of your family members that would be enrolling are part of a federally recognized Indian tribe or Alaskan Native tribe. And the reason they ask that is because there's different enrollment guidelines. I'm gonna say no. And here it says, do you have a certificate of exemption? And that's what we touched on if you have an exemption from healthcare.gov. If you make a certain amount, or if you're under that 100%, and you would know if you were eligible, you would know if you received this, but that's what they're referring to. So I'm gonna say no. So then you scroll down, ooh, there. Okay. So again, it's asking some personal information, it's not retaining any of this. So you wanna hit submit. And what's going to come up is a summary page. So you just want to verify you entered it correctly. I entered that my income is $15,000, so it's telling me I'm at 131% of the federal poverty level. There's 1 person in my household. If I do not choose to take insurance, my penalty would be $95 because the 1% is lower than the $95. If that 1% of my income was higher, it would show here what actually I am responsible for. And then here it says I am eligible to receive $373.44 per month for an advanced tax credit. So you want to scroll down and hit Browse Plans. And it's going to bring up our plans and what you would pay monthly. So if you chose to have this bronze plan based on that income, you would be paying $1.57 per month for your premium. It also will show, and you can click on and look at the full benefit summary where it will tell you exactly what's covered and the details of it, but this will give you a summary of what is out of pocket for you. So under that bronze plan, it's saying that the deductible, when we talked about the premium will be lower, out of pocket would be higher. The deductible is $5,000 on this plan, and then the out of pocket max is that $6,350 that we spoke of. The co-insurance percent is 50%. Primary visits are $45. Generic prescriptions are $30. So again, this is the bronze plan, yes.
Can you back that up and try what the gold package would be?
Yeah, I'm gonna actually scroll down. It's all right on this page.
Thank you.
Yep, and so it will bring up every plan that you are eligible. And again, this is our site. It's gonna just bring up Maine Community Health Plan. It will not bring up Anthem, but on healthcare.gov it would bring up both.
On the co-insurance, is that what is presented to you, meaning the doctor says your fee for this is $75, you pay 50% of that $75?
What you'd want, the co-insurance, it would depend on the plan, so that's where you'd want to go into the benefit summary and see what actually falls under the co-insurance. The primary care visit might, would have that $45. You might go, into the emergency room, and that might be where you pay. So it would be 50% of the charge.
50% of the charge. So the doctor has agreed on this amount for an office visit.
Correct.
The insurance will pay 50% of that, and you will pay 50% of that.
Exactly.
Because other insurances don't quite do that.
Right, and it would be up to that max. So your prescriptions, your co-pays, your co-insurance, your deductible, all of those go towards your out-of-pocket. So once you hit that $6,350, you won't pay anything additional in that year.
Normally with a deductible like this, you would have to meet your deductible and then it would pay 50%
Yep.
until you meet the $6,350, is that the way this works?
Correct.
So you really have a $5,000 out of pocket before you're gonna get any benefits?
With
Except preventive.
It depends on the structure of the plan, but that is the typical way that co-insurance works. You would meet your deductible and it flips over then to a co-insurance. And then that co-insurance, everything's still adding up. Now, the deductible is $5,000. That is combined in your out-of-pocket. So you're not paying $5,000 starting over. You're paying $5,000, prescriptions, everything else is going toward that $6,000. So, a lot of folks thought, okay, I have to meet $5,000, then now I have to meet $6,000, it is combined. But the typical structure of a plan is once a deductible met, it kicks over to a co-insurance.
So, I guess what you're saying is, say if I went to the hospital and the bill was $3,000, I'd have to pay that out of my pocket until we met that deductible of $6,000, right?
Correct, unless, on the plan, an emergency room visit may have, and again, we'd have to go into each plan to look specifically, but it may be that the emergency room visit has a $250 copay, which means that would be the amount you would pay. The different benefits that fall within the plan, some will have a copay, some will have a co-insurance. So the ones that have a co-insurance, you're right, you would be paying to that deductible. Once that deductible hits, you would flip over to then the percentage. And all of that's going to the out-of-pocket. And again, this is the higher out-of-pocket, lower premium. So if you scroll down, the silver plan is $1.57. Oh no, that's another bronze. Silver plan is $9.58. Your deductible drops to $2,350, and the out-of-pocket remains at the $6,350. Your co-payment drops to $20, and your generic drops to $15. Something we haven't talked about we've talked about the 100% to the 400%, and those are the folks that are eligible for an advanced tax credit. Folks that are between 100% and 250% are also eligible for an additional assistance, which is cost sharing reduction. And what that does is it reduces any of your out-of-pocket. There's an assistance with your copays, your co-insurance, your out-of-pocket limit, and that happens up front, just like your advanced tax credit. So if my premium was supposed to be $300 and now it's $958, my bill will say $958, and that's what I pay. At the same time, the government will be paying the qualified health plan the remainder. So you're not burdened with paying the full premium up front, which is the same with the cost sharing. So the silver plan that we just looked at, that's the standard silver based on the income. Like I said, my premium would be $958. If you scroll down a little bit here, you'll see this cost sharing reduction, which I'm eligible for. My premium would remain the same, but my deductible now has dropped to $200, and my out-of-pocket max is $500. Co-insurance is 10%, office primary visit is 5%, generics are 5%. So 100% to 250%. If you fall within that range, if you're eligible to receive a tax credit, you are also eligible to receive the cost sharing reduction. And this happens in advance as well. Your card will say $5. There will be no identifying marks on the card that will show that you fall within this income range, and we'd be receiving, the remaining portion of the out-of-pocket from the government at the same time.
What exactly do you mean by the cost sharing reduction?
How do you get eligible?
Well, if you fall the 100% for an individual, if you make between $11,190 and 250%, which is $28,725. So if you fall within that range and you're eligible to receive that advanced tax credit, meaning you don't have insurance offered to you, you know, you're not on Medicare, then, and you are eligible for that tax credit, if you fall within that income range, you're also eligible for additional assistance through the government, and they're calling that the cost sharing reduction.
But
So
if
it's just an additional layer of savings for the folks that fall within that range.
If you don't fall within that range, then you'd have to take just the silver, right? Or I mean, you could take just the silver.
It would be the silver would be the plan that we looked at above.
Right, but you couldn't take the cost sharing.
It will, no, and it won't
Okay.
even pop up when this comes
Oh,
up.
okay.
This only popped up because I put my income at a range where I knew it would, so I could show you guys.
Okay.
And so the cost sharing is only offered on a silver plan. So you'll see that it wasn't offered on the bronze and it won't be offered on the gold. They do offer it just solely on the silver plan. And so folks are like, why do they like put the normal silver and the cost sharing reduction? It is because both are there. They could sign up for either. I don't think anyone would choose to sign up for the regular silver if they're eligible to the cost sharing reduction.
You said the lifetime, the out-of-pocket expense is lifetime. The deductible must roll over each year. How does that work?
The deductible, we've chosen to have it roll over if whatever you contribute to that deductible within the last 3 months. So if you didn't have any expenses all year and you met the full $500 in November, then that's gonna roll over to the following year. If you met $20 in October, $20 would roll over. So anything prior to that, yeah, so we're crediting that to the following year. And there is no lifetime max. And again, so this $500 is the most that I would pay out of pocket. At 501, my coverage would, other than the premium, my coverage and care would be covered at 100% and no additional charge.
Does this compare Anthem and you guys? Is there a way to look at both those if we had a consult?
On
to see
healthcare,
what's best?
on healthcare.gov, that's how it is designed. It has not been, and that's something that Deb can certainly do with you as well. And I think on the Bureau of Insurance website, they're still doing it. You can actually go in there and look at ours side by side. But while healthcare.gov is not functioning as smoothly as we hoped, you'd have, if you did it through our website, you'd have to look at ours, then go to Anthem and compare it that way.
But you guys can help us with it?
Yeah, absolutely. Yep, Deb can do it. You can, you know, there's any of the contacts she gave, they're excellent at assisting. So your question about the gold, if we scroll down in the metal level, I didn't point that out, but you'll see it's always on the right-hand side of what level. Oh, I am still here. So the gold, my premium would be $131.36. My deductible would be $650, and my out-of-pocket would be $2,500, which is $2,000 higher than that cost sharing. So the gold plan is the richest plan unless you are eligible for a cost sharing reduction. And with that cost sharing reduction, because it only falls on and is goes to the silver plan, it really makes the silver plan a richer plan. You're gonna get the same benefits, but your out-of-pocket will be less than the gold. And that's the only time that happens is if you are eligible for that cost sharing reduction. Questions?
Can you clarify the difference between a straight tax credit and the premium reduction?
Yep, the tax, so we're a qualified health plan, and we have our standard premiums. Anybody can enroll with us, whether they qualify for a tax credit or not. But if you do qualify, you go through the marketplace, and we have that verified. So here's our premium. Now that tax credit is going to lay on top of that and reduce your premium. If you fall within that income bracket, you're gonna receive that advanced tax credit, but in addition, you're gonna have another layer of savings and assistance offered to you, and that's the cost sharing reduction. So your premium has already been reduced, and now they're reducing your out-of-pocket costs, your co-pays, co-insurance, deductible, and out-of-pocket limit.
And so the basic tax credit, you can apply that to any level, any metal level.
Yep, the advanced tax credit is, they base the amount on the silver plan. So when you look at, this and you say, okay, I fall at 200%, so they're saying, what's affordable is 6.3% of my income, so, which is $121. So that's gonna be for the silver plan. So you could take that $121 and enroll with a bronze plan, and you would be paying less than the 6.3. You'd be, or you could take that $121 and put it toward the gold plan, where you're gonna be paying more than that, what's considered affordable. But they're basing, they had to base it on one plan, so they chose to base it on silver, which is the middle plan. And so you could end up paying a little bit more, you could pay a little bit less depending on where you want to put that. The advanced tax credit is also advanced because you're not burdened with paying the premium up front. It does go at the same time that your premiums are due. However, it is designed where you can go in and budget that. So if you are a fisherman, you make your money in the summer, but in the winter you can't feed your family, or you can't fill the oil tank. You might say, I want to pay all of my premiums in the summer, and then I want to take the tax credit in the winter where they would be paying nothing, because they would take the larger amount. So you can go into healthcare.gov or through Deb or through the 1-800 number and adjust that throughout the year. And I do want to mention that the advanced tax credit is based on your income, but it's based on your estimated income for 2014. So what they're going to say, bring your W-2, and that they're doing that because they're considering that the most accurate of your income. There could have been enormous changes. You could have lost a job, gained a job. Your business might be doing better, might be doing worse. So you really want to be as accurate as possible when you're putting in your income. You want to estimate it. So if folks might say, oh, I'm going to estimate that I'm going to make $20,000 because then I'll get a larger tax credit, but I know I'm going to make 30. At the end of the year, when you file your taxes, they're going to say, oh, you received more tax credit than you should have based on your income, and they're going to take that back. On the flip side, if you said I'm going to make 30 and you ended up making 20, you're going to get a larger return at the end of the year because you were eligible to receive more throughout the year that you did not take. So we encourage folks to, once they enroll, to not just say I'm enrolled and not look back. Keep your account, remember your password, and go in throughout the year. If you have any fluctuation in your income, update it so it stays as accurate as possible. So when you do file your taxes, there's no surprise at the end of the year.
And one
second.
I guess I'll let you answer her first, okay?
Okay.
Okay. I just want clarification on the 9.5%. If your income is below 400% of the poverty level, should you have to pay more than 9.5% of your income for any premium on these plans?
I'm not sure I understand.
So you don't have this for families, for two people, you have it for one or the other, but.
It is a sliding percentage.
Right, okay, but if you fall under 400%, your household income is under 400%, when I look at all the premiums out there between Anthem and yours as well, it comes, even with the tax credit that I've been able to come up with, it comes up to way, way more than 9.5% of our income. So I don't know if I'm getting weird feedback from the.
And are you looking at the silver plan?
I'm looking at, the silver, and even the gold is higher than I calculate it should be.
Yeah, and the gold would be above that because that's
the bronze,
the bronze.
I'm talking about the lowest level you can go.
Yeah, it should coincide with the sliding percentage.
I'm not finding that to be true.
Okay.
It's about twice, I'm getting estimates at twice.
Okay, now this is an individual, and so, if you're looking at, if you file, it's gonna be, it's gonna be based on your family income. But that, Deb you might wanna sit with Deb and make sure the numbers, I don't wanna punch in any numbers here, but and just go over that, and we can check and verify, and if, you know, there is something that's coming up incorrectly, we can certainly.
But you can't say across the board that the 9.5% should be the max that an individual.
On a
would-
silver plan, what they're saying is that's what's considered affordable.
Okay. And that's per individual then?
Yes.
Yes, I guess I just missed something you said.
Yeah.
What makes you eligible for a estimated tax credit?
For the advanced tax credit,
Yes.
to become eligible, you cannot have any other insurance available to you.
Mhm.
You need to, your income needs to fall between that 100% of the federal poverty level and the 400% of the federal
Mhm.
poverty level. And so if you're within that range, you don't have insurance available to you, or your insurance that is available is considered unaffordable, then you're eligible to receive an advanced tax credit.
Yeah, and how do you figure that?
Well, when we were, went to at the beginning, when I
Yeah.
punched in, that's where you would punched in and it automatically calculated that for me. But it's based on your income, where your taxable adjusted income.
Oh, okay, now what about the cost sharing?
The cost,
reduction?
yep, the cost sharing reduction is if you are eligible to receive that advanced tax credit.
Yeah,
And then on top of that, your income is between the 100% of the federal poverty level and 250%.
oh, okay.
So it's a smaller range.
Yeah.
It's the lower end of that. If you fall within that and you meet the criteria to receive an advanced tax credit, you're also eligible then to receive that cost sharing
Okay, thank you.
assistance. You're welcome.
An additional question, sort of attached to Mr. Topman, right?
Yeah, hi.
And that, you said if you didn't have health insurance or if it was more.
Yep.
So suppose we had the meeting, Deb and I,
Yep.
and found out we're an answer. How, is there a limit? Say,
It's that
if it was
nine-
just a few dollars, I'd just stay with where I'm at. But if
Yep.
it was, you know, a few $100s, is there a limit? I mean, could I qualify and decide, hey, go with you guys, because it's a few $100s more a month, I'd like to save money. Is there a limit to that?
Well,
That's what I'm
let me
saying.
see if I understand your question. So what's offered to you now, is it through an employer?
Yeah.
Okay, if that's considered affordable, which is that 9.5%, if that's considered affordable, what's offered to you, then you would not be eligible for the tax credit. But you could enroll with us and pay the full premium, but if your insurance through your employer is considered affordable, you're exempt from the tax credit.
It has, I guess I was thinking comparatively, if I save money being with you guys, in terms of monthly whatever,
Yeah.
it would be foolish not to.
Right, and we do encourage people to really to go on Anthem, to go on Maine Community. You know, we're new, we want folks to know about us, we want folks to enroll, but we want folks to enroll in the right coverage for them. Before I wrap up, I want to just touch on a couple of things about Maine Community that I think I mentioned the tobacco. Did I mention that here? That we don't penalize folks with the premium for smoking. What we figure is that if we say, do you smoke? And if you smoke, we're going to charge you more for your premium. Folks are going to lie because how would we know? But as soon as somebody says, no, I don't smoke, they've really cut themselves off for receiving any assistance to stop smoking. So we don't want to penalize folks. We want people to be honest. And what we've done is we've removed that penalty and we've enhanced our smoking cessation support. We support multiple attempts at stopping. There's coverage for non-nicotine replacement products, the electronic cigarette. There's great support. So we're encouraging folks to be honest. We don't want to penalize them up front. We really want to assist them to stop. We also have what we're calling the chronic illness support program. And this is included just as standard in all of our plans, except there's an HSA plan out there, and that's a health savings account. And so some folks have that, and it's a savings account where there's pre-tax dollars in there, and that you can use towards any out-of-pocket. So if you have a health savings account, you know, at a bank that you want to use a plan that's compatible with that. We have a health savings account compatible plan, but the chronic illness support program is not included in that. So the majority of our plans, the program that I'm going to speak of is just generally included in as a standard coverage. But we have chosen 3 chronic illnesses for the first year: diabetes, asthma, COPD, and hypertension. But what did I not say? 3? Oh, there's 4. I'm sorry. Hypertension, COPD, asthma, and diabetes. And what that is we're trying to remove financial barriers for folks. We don't want someone to say, I can't afford to feed my family, so I'm gonna, you know, snap this pill in half. I'm gonna not take my inhaler every time I have an asthma attack because, you know, I have to pay childcare. We've all done it, I've done it. You know, it's the rationing of your care. And we don't want that to happen. We want people to get the right care at the right time. We want their illness to be maintained and kept at a level that's healthy. So down the road, they're not inpatient, they don't receive an amputation, and that we clearly will pay for when they're ill, but we are trying to have people be able to afford to maintain their illness. So what we've done is we have reduced or removed any financial barriers. So if you go to your doctor for this diagnosis or specialist, there's no copay. The member would pay nothing. If you picked up any generic prescriptions, if your inhaler is generic, if your insulin is generic, you will pay nothing when you go to the pharmacy. And the higher tier prescriptions are at a reduced cost. If you need a piece of equipment like a nebulizer for your asthma, that's at 50% of the out-of-pocket cost that you would typically pay. So we really are trying to remove that financial barrier for folks. And it's a great program. You know, we want to increase it. We want to add, you know, additional diseases as the years come. It's our first year, so we want to, you know, really focus on the 4, these being the 4 that are most common. So it really is quite an assistance for folks that have these illnesses where they don't need to worry about the upfront cost of their care.
If you pay your premium per month and say you're hospitalized and you're out of work, what happens then? Can they apply for something else? Or
Meaning, would they pay?
Say I have insurance and I end up in the hospital for a couple months.
Yeah.
And I didn't pay the premium.
You have to pay the premium. If you fall behind, we have to receive, it's 3 months. And so if you stop paying in June, we have to receive full payment of the 3 months, you know, all premiums by the end of that 3rd month. So we're not going to, you know, not cover you the 2nd month. You're going to be getting notices, but if you go 3 months, at the end of that 3rd month, if we haven't received all the payment, at that point, that's where your coverage would terminate.
But you would update your income during that time if you were to lose your salary, so that would change your premium, right? Or no?
Yeah, if you go in and adjust, right, if they went in and adjusted, it would adjust your premium. But again, if you still fell behind, that's the guidelines.
Can you start off at the bronze level and work yourself up?
You can. Once you decide, her question was, can you start at a bronze level and change that throughout the year? In open enrollment, that's where you choose your metal level. You can change it then next open enrollment, but you cannot fluctuate within the year. For small businesses, the first year it is the employer's choice. So if they chose Anthem or if they chose the Maine Community Health Options, they're going to choose which level they're offering their employees. And the employees, you know, then would have the silver or gold, whichever level the employer chose. In the years to come, it's going to be the employee's choice, meaning the employer will choose which carrier, Anthem or Maine Community, and then you can choose which level, metal level within, but it's that one time per year.
I had a question about the prescription. If you have a prescription that needs to be filled, do you have to pay the deductible, let's say the $200 deductible, before you can get the $5 copay?
Nope. Nope, for generic, it's $5. So the copays that are there, if you see a copay for an office visit, a prescription, that's the copay. It's the co-insurance where you'd meet the deductible prior to the co-insurance kicking in. You're welcome. Any other questions? It's a lot of information, I know.
One more of an ideological one, but I think it affects our whole society. We talk about these chronic diseases and the help that's given so that they're not having to pay. But still, the supplies and nebulizers, the doctors, that's still the same. Where's the cost being made up for that? I mean, you guys absorb it, this particular?
We do,
Okay.
and because we want to.
I just want to make sure it's not passed on to.
Oh, no, we absorb that because that's something that we're offering, that's not from the government. And we are nonprofit, I think I mentioned it earlier, I just want to reiterate that, you know, anything that we make above and beyond keeping us afloat, paying back our loans is going to go into keeping our premiums low and enhancing those benefits where it would give us the opportunity to add additional illnesses to that program.
Will there be any dental involved in this insurance?
That's a great question. One of the essential benefits, her question was, is there dental? It says that the dental for children is a required coverage, but part of that actually states that as long as there's dental available on the marketplace, then the health insurance does not have to offer it. And Delta Dental has a plan that's being offered. So Anthem and Maine Community, we did not have to include it. I believe Anthem might have one plan that includes a pediatric dental. We do not have any because there is a Delta Dental plan available. And so that just helped us keep our premiums lower by not including the dental, but as long as there is something offered for folks, it meets the requirement of the law. Also on vision, there is, you get an eye exam, an adult every 2 years, and one every year for a child or if you have diabetes.
So if I got sick tomorrow and I went into the hospital, and say the hospital bill was like $40,000, with the deductible and the co-pays, the most I'd absolutely have to pay is the $6,350.
Yep, or if you had this cost sharing reduction, it would be that $500 or whatever, $500. So whatever plan you choose, whatever where it states the out-of-pocket, whatever that is gonna be the most that you will pay. And that's an individual. So again, if that's a family, one person would have to meet that $500, and then the family combined would each meet that secondary $500.
But to get that cost sharing reduction, what would your income have to be?
It has to fall within that 100 to 250%. So that's, again, it's for an individual, it's 11,490 to 28,725. So an individual, if you fall within that range and you're eligible to receive the advanced tax credit, you would also be eligible to receive that cost sharing reduction.
Do you know if your plan, what happens if you go out of state and you get sick?
That's the RAP network that we talked about. There is coverage, there's in-network coverage available, and so online you can check, if you're a snowbird and you're down in Florida, you can check who's in network, who's out of network, but there's in-network availability to you at all times.
Do you have to be pre-approved for certain tests or hospitals?
There needs to be, as long as it's a covered benefit, we're a PPO plan, and what that means is you do not need to have referrals. Referrals are not required. You are required to have a primary care physician, and that primary care physician needs to be in network. If you don't choose one is chosen for you, so it's on your, on your card. But again, you don't need to, the old term is the gatekeeper. They've removed, through the PPO plan, you don't have that. It's, you can go direct as long as it's a covered benefit. And if you go to an in-network doctor, it will go towards that, your in-network, out-of-pocket. You can go to your doctor of choice even if they're out of network, but that's at a different coverage level. So I want to be sensitive of your time and your bellies. I'm sure a lot of you are starving. If you have additional questions, you know, I'll be here, Deb will be here, and also she's a wonderful resource. And our call center is open until 6 p.m. We're gonna, I think, extend that to 8 through the open enrollment. Call us if you have questions, you know, set up an appointment with Deb, and she can go over your personal situation and see what we can get offered for you.
Could I just add one thing while I still have a full group here? There will be an event at Porter Memorial Library in November where you can sit down with a navigator. I think it's November 9.
Heck, I was afraid you was gonna say, before you got out of here, I gotta get these tests.
Yeah, a shot. No, anyway, November 9 from 2 to 6 p.m. We're gonna have navigators here in Machias at Porter Memorial Library. So please pick up one of these if you're interested.
Does this insurance make a difference whether you're self-employed or not? Or is everything just taken off your income tax? When you punch your numbers in to go to apply for it, you get it off your income tax?
It's not off your income tax, it's an advanced tax credit. So if you were getting a $1,000 return at the end of the year, you would still get that $1,000 return. This is additional support. So this isn't it's not taking your refund and breaking it up through the year. This is actually an advanced tax credit. It makes it sound like that, but it is, it's coming from the government. You did.
No, I think what she meant was, if you're self-employed,
Right.
and you don't get a W-2, obviously. So you use the figures off your income tax, is what she asked.
Correct.
Okay.
Oh, yes, thank you.
Okay, just as if you were an individual, it doesn't matter.
Yeah, it's based on how you file your taxes.
Okay.
Yeah, I think what can be confusing for some is the word credit. On taxes, the only credit that you receive with no income is the earned income tax credit. I assume this works like that. If you have no tax liability, you still get a credit?
If you don't file taxes?
No.
Or if you would receive none?
Correct. In other words, you have no tax liability, you still have a credit.
Yes, absolutely. You could be needing to pay at the end of the year, but this is, if you make within this income range, you're eligible for this assistance. Good point.
May we have the list of names so they help us?
Oh, yes, let me unhook, and I shut your computer so I can.
Whether you know, on the 9th.